we definitely have a problem.
Last year, millions of parents learned that they were their teen's drug dealer.
Prescription drugs have just simply become, I think, the epidemic of this generation.
Overdoses on a daily basis.
This should be a shot heard around the state.
We've got to do better to protect our kids.
Cameron was our middle son, and he was born here in Little Rock in '86, and had a reasonably normal younger childhood. Sweet kid, a lot of fun to be around, but he started smoking marijuana when he was 12. From then on, we had real issues with it. My wife and I were out, and my younger son and Cameron were in the hotel room by themselves, and he's fishing around his mom's purse for some reason. When he took that first hydrocodone pill, that to him was a breakthrough moment. That pill made him feel like he wanted to feel.
In 96 or 98, the big pharma came out with these dangerous drugs like Oxycontin, hydrocodone. They basically posed them as non-addictive.
We're seeing it more in the younger populations. There's obviously the demographics have changed a little bit. It's the 20 to 40s and 50 years old that are actually going into the physician's office requesting the narcotic pain medication or to the ERs. But we're starting to see a larger and larger problem in the younger age groups and kids that are getting access to it from their parents.
We actually showed a few years back we were the #1 state in the nation for the abuse by adolescents of opiates.
64% of teens from the age of 12 to 17 have admitted to using and abusing prescription type pills and medicines.
There are more kids that die because of prescription drug overdose or drug overdose than there are dying in car accidents today. One of the statistics that has blown my mind for Arkansas specific kids 12 to 17, every day there are about 40 school buses full of kids, school-age kids, who try prescription drugs for the first time.
It's all simple. It looks easy to the kids to go into the medicine chest and take some pills and get high, but they don't realize, they don't understand that this may be life-altering. This may be, the end of their life as they know it.
5 years ago, when we got a new chief of police in Benton, Kurt Lane, the local tombstone maker, made an appointment, spent 4 hours with him in his office. He said, "Chief, I made 18 tombstones last year for teenagers that died from drug overdose. I want you to do something about it."
You know what? I got started in it because I spent the majority of my career in drug law enforcement before I became chief at Benton. And when I got confronted by a member of our public about what am I going to do about the prescription drug problem, and I kind of looked at him and said, "What problem?"
Many of these people, these young people particularly who have problems, they're basically crying out for somebody to help them.
After his freshman year or whatever, he maybe his sophomore year, he came home and he asked us to sit down. He said, "I got to go to rehab." I think he probably went voluntarily a couple of times and involuntarily a couple of times. He was clean for 9 months. The 6 months he was in that rehab, and then the 3 months afterwards, one of his buddies from rehab relapsed and OD'd. And so Cameron went to the funeral, and it freaked him out. So he's driving home arranging drugs. Went out the first night that he was here to have dinner with his buddies, and he relapsed. It was the biggest letdown of his entire journey through this addiction.
How are y'all doing today?
Doing great, officers. How about yourself?
Thank you very much.
Thank you.
Be
Thank
safe.
you. Have a great day.
The drug take back
program is extremely important for communities like ours and all across the country, because we have 44 people that are dying every single day from prescription drug overdoses, and that's a very sad statistic for communities, and we're hoping that through takebacks we'll be able to help make a change for the positive in our community.
We actually are doing quite a bit to alleviate this problem. Our legislature passed a prescription drug monitoring law to better control prescriptions. The DEA, local law enforcement are sponsoring drug take-back programs, sponsoring places where parents can dispose of unused prescription medication.
70% of what's being abused comes out of our homes, either willingly or unwillingly. And so we want to make sure that people, the prescriptions that they need, especially the ones of abuse, get locked up, like jewelry or a firearm, and kept out of harm's way. And then the ones that you aren't using anymore, you don't need anymore, to store them properly. A drug take-back or a 24-hour drug take-back box is a great way to do that.
There is a drop box in every county in the state of Arkansas.
This is really a clean out your cabinets. You know, when we see drug takebacks and people have prescription drugs that have been in their cabinets for a decade or longer, that's very concerning.
What can you take back? The answer is anything, whether it's a solid dosage form, a liquid, prescription medicine, over-the-counter, herbal, vitamin. Any of those are medications in your house, and if you don't need them on a regular basis, they shouldn't be there.
One of the really good things about these take-back programs is if you're worried about the environment at all, you know, this is a method where these medications are destroyed by incineration. They're not going in a landfill, they're not going in a water supply, they're not going down a toilet or anywhere else where they can be used. This is the best method to get rid of these pills.
This drug take-back program has been so successful because law enforcement has gotten on board with our partners in the community and state government, the business community.
Rotary's motto is service above self. We partner with Rotary clubs around the world in 170 plus countries, but there's a lot we need to do right here in our own backyard.
As Attorney General, I am committed to bringing awareness of this issue and to work with community leaders, law enforcement, physicians, and pharmacists to eradicate this problem. Already we participate in drug take-back days in April and September, but as I've said many times, that every day should be a take-back day for Arkansans.
When we're dealing with the Arkansas prescription drug take-back events, you know, when we're looking at pulling in 20,000 pounds of pills every 6 months, that is an astronomical number.
We had words, you know, yelling at each other and everything about relapse. So I said to him, you've got to go back. He did not want to go back into detox. He did not want to go back into rehab. And so, you know, at the point in time and he realized that I was serious about him going back into rehab, you know, on a Friday morning, he was going to drive back to Atlanta. He shot himself in his bedroom at our house. You know, losing a kid is awful. And anywhere and every time is the worst thing you can go through. Losing a kid to suicide is really awful because you've got the grief, but you also have this guilt.
We've made a big difference, but the problem isn't gone away.
We need the whole state involved, from A to Z.
The last few years, Arkansas has really taken a hardline focus on this, where we've had Arkansas Prescription Drug Abuse Summits, and we've invited people from all kinds of areas such as healthcare, community activists, law enforcement, and several other areas to help talk about the problems we have with prescription drug abuse in the state of Arkansas.
We all have to pull together to make sure we're getting the message out about the danger of prescription drug abuse, but also what's out there that can help parents, teenagers, make sure that doesn't become a problem in their life.
These drugs that we take in will never be used for anything else. They won't be put back in for an undercover operation. They won't be put back in for any other purpose but to be destroyed. They'll never harm anybody again.
What Cameron realized ultimately is I don't want to live this way. I hate these pills, I love these pills, what do I do about that? In a very real way, when you go toss your pain pills back away, you can save yourself, you're helping to save lives. I assure you of that.
We've seen the Take Back program just explode, and Rotary's been a huge part of that. There are literally tons of medications that are taken back and destroyed every time that there's a Take Back program. Arkansas is among the leading states in the nation when it comes to taking prescription drugs back off the street.
These collection sites provide a safe and easy way to properly dispose of prescription medications and to help you protect your family. For more information, visit artakeback.org to find a drug take-back location near you. Let's protect our kids.